Good afternoon. My name is Callista Kennedy. I am the Project Program Manager for the Navigator work at King County Public Health. I'm with the Access and Outreach team.
daawadayaal ku soo dhawaada warbaahinta bulshada ee Somali Bridge. Waxaa barnaamijka marti noogu ah Callista Kennedy oo u shaqeysa waaxda caafimaadka ee Seattle iyo King County una qaabilsan dhanka helitaanka caymiska caafimaadka. Ku soo dhawow warbaahinta Somali Bridge.
I would like to thank the Somali Bridge for having me on today to speak to your community.
Aan ka hadalno caymiska caafimaadka. Waxaan maqalnay in laga bilaabo bishan May dadka qaarkiis looga baahan yahay inay qaadaan tallaabooyin dheeri ah si ay u ilaashadaan caymiska Apple Health Medicaid.
So during the pandemic, the federal government put in stipulations or rules that allowed states to keep people who had become eligible for what we call in Washington Apple Health, which is Medicaid, to keep them enrolled throughout the public health emergency, regardless of changes to their household and income. If they had qualified at one point, they were to remain eligible until the end of the public health emergency. So recently what happened is there were changes and the public health emergency is coming to an end. So what's happening is the process that was in place before the public health emergency started is coming back. And what that means is you have to renew your coverage. Prior to this, once a year, individuals had to go and make sure that their household address, income, the people that are in their household, their kids, their spouses, all of that information was up to date with the state. And you had to do that once a year before the public health emergency. And that is simply coming back. So it's extra steps from what we've been used to in the last 3 years or so, but it's just really a return to normal application process.
Qof kasta oo haysta Apple Health ma inuu dib isu diiwaan geliyaa mise waa dadka qaar.
It's not really re-enroll because we haven't cut anybody off yet, but what we're doing is we're renewing your coverage. And everyone at some point is going to have to renew. Now there can be a different process for some people than others. So the state has a method to what they call auto-renew someone. So they'll look at your application electronically. They'll see who's in the household, whether it's, husband, wife, kids, who's in the household, what the reported income is. And they will try to verify that through the electronic sources that are attached to the health plan finder. They may just auto-renew you and say, okay, everything matched up from our electronic databases, therefore you're still eligible. If they cannot do that, they will send you notification that you need to go in and you need to update your information for us to see if you're still eligible. So everybody's going to have to renew. It just might be more work for some households than others. Just depends on your particular set of circumstances and who's in the house and where your income is coming from.
Maxay dadka hadda haysta caymiska Apple Health u baahan yihiin inay sameeyaan?
First thing they need to do is make sure that their information in the state system, the Washington Health Plan Finder, make sure that information is up to date. Make sure your address is current. Make sure your telephone number is current. So that when the state sends you out a notification, that you're getting that notification that will instruct you with the steps that you need to take.
Goorma ayay dadku helayaan waraaqaha dib cusboonaysiinta?
So it'll be 60 days before your renewal is due. And that's going to be based on when you signed up and became eligible. So for example, if someone became eligible in August of 2020 and they've continued their eligibility, they'll get a notice in June because their coverage would end August 31st. And then that notification will let you know when your end date is and that you should, you may need to take action. And then they will try to auto-renew you. And if they can't auto-renew you, usually at about the 45-day mark, you still have 45 days left, then you'll get another notification that says, hey, you're approved. Or if you're not approved, they couldn't auto-renew you, they'll say, okay, you need to go in and take action. So everybody really will get 2 notifications that they're upcoming for their renewal date.
Maxay dadku u baahan yihiin inay sameeyaan si ay u cusboonaysiiyaan caymiska ama insuransigooda?
So if you need to renew your coverage, one of the best things that you can do is if you need help, reach out to us. Access and Outreach with King County Public Health, we're the lead for the health insurance enrollment in King County, we have an 800 number. People can call Monday through Saturday. Monday through Friday, it's open from 7:30 to 6, and then Saturdays from 10 to 2. We do have a navigator on our team who speaks Somali, but if you call our number, it's 1-800-756-5437. We can get you connected.
ka waran haddii aadan helin warqad kuu sheegaysa inaad dib isu diiwaan geliso.
So that can happen a lot of times. Like I said, people still don't remember to go in and update their address, or they mistake the letter for junk mail or something else. If you miss your enrollment window, it's not too late to get yourself reconnected with insurance. With Apple Health, if you are still eligible but you got closed because you missed your enrollment window, we can still go back and reapply. If you're eligible for that particular program, you can re-enroll at any time. If perhaps you missed your window and you're no longer eligible for the Apple Health program, we do have an additional 60 days after your closure to get you connected with another type of insurance. And then there's also other types of situations, we call them qualifying life events, if you had something occur in your household where we can still get you reconnected with insurance if you missed your enrollment and got cut off of the Apple Health.
maxaa dhacaya haddii dadku ogaadaan inaysan u qalmin ama lumiyaan caymiskooda Apple Health?
So for those who are no longer eligible for Apple Health, there's a couple different avenues we can look at. The first is the qualified health plans that are offered through the Health Benefit Exchange. The same site where you enroll in Apple Health also looks for that Affordable Care Act program. So if you still can't get insurance through Apple, you can't get insurance through a job, we'll look at, can we get you some assistance through the Affordable Care Act, through those tax credits, to get you an affordable plan. With the state's new Cascade Care program, we have seen people who have incomed out of Apple Health be eligible for a plan as little as $10. So it's going to look at your circumstances, so we may be able to get you connected with an insurance and explain to you all the differences of the impact of cost and actually having to pay a monthly premium. That's the assistance that we're there to give and to make sure that people understand if they do have to buy something, what they're buying.